Whether a suspicious lump is cancerous is stressful.
Yeah, so anything that shortens that window of time and can lead to a faster treatment if needed is a huge help. Wink News health and medical reporter Amy Osher explains local doctors are making the biopsy more efficient to speed up the process.
With a needle in one hand and an ultrasound device in the other, Aileen Fiallo probes suspicious lumps, lesions, or masses in the neck, taking a few samples for a biopsy.
And these can be really tiny lesions, can't
Absolutely. Sometimes they could be very difficult to get to.
It would be nearly impossible without a live ultrasound guide.
We use it, put it on the neck or wherever the neck mass is, and with guidance from the ultrasound, we stick a little needle into the neck mass and we could visually see it through the ultrasound. I'm able to actually see that I'm going to the correct area.
To speed the biopsy process, an on-site pathologist at Precision Healthcare Specialists in Fort Myers reviews the sample immediately after it's taken.
They're mounted on here and the sections are cut and picked up on a slide.
While the patient waits, Dr. Brian Babin makes sure there's enough tissue to work with and that it captured the suspicious cells, avoiding a second visit.
It does save a lot of time and it's more efficient for the patient because, again, we could tell the person doing the procedure whether or not they've obtained enough material to provide a diagnosis or enough diagnostic information.
The combination of an in-office procedure and pathology paves the way for quick answers. Many times they can confirm cancer on the spot. The time saving is significant compared to sending out the biopsy.
Everything's so backed up that's taking 2 or 3 weeks to get a biopsy done and somewhere in a different location. And then when the patient comes back, this thing has grown significantly.
The process takes under an hour. The pathology providing cancer patients a head start fighting their disease. Amy Osher, Wink News.
Amy, thanks. The full pathology workup takes 1 to 2 days. Doctors make the final diagnosis by examining the biopsy along with any other scans or tests. That helps identify the type of cancer and guides treatment options.